Welcome back to Medicine Health 360. Today we're diving into the fascinating world of non-invasive prenatal testing, or NIPT, a groundbreaking innovation in prenatal care that has transformed how we assess the health of unborn babies. Whether you're an expectant parent or simply curious about medical advancements, this video is for you. So, let's get started. What is NIPT? Non-Invasive Prenatal Testing, or NIPT, is a simple blood test performed during pregnancy. It analyzes tiny fragments of fetal DNA circulating in the mother's bloodstream, called cell-free fetal DNA, or cfDNA. This test screens for chromosomal abnormalities such as Down syndrome, which is trisomy 21, Edwards syndrome, known as trisomy 18, Fetal syndrome, or trisomy 13, and sex chromosome abnormalities like Turner or Klinefelter syndrome. NIPT can also reveal the baby's gender with remarkable accuracy. This incredible test is typically available as early as 10 weeks of pregnancy. How does NIPT work? Let's break it down. During pregnancy, the placenta releases fragments of fetal DNA into the mother's bloodstream. These fragments, while tiny, carry the genetic blueprint of the baby. Using advanced techniques like next-generation sequencing or NGS, scientists examine these fragments to detect any chromosomal abnormalities. Sophisticated algorithms analyze the data, identifying conditions like extra or missing chromosomes. Unlike traditional methods like amniocentesis or chorionic villus sampling, which carry a small risk of miscarriage, NIPT is completely safe for both mother and baby. It requires only a simple blood draw. NIPT has changed lives around the world. Here are some inspiring and thought-provoking examples. Many expecting parents share their NIPT success stories online. For instance, a couple on Reddit described how NIPT's low-risk results provided them peace of mind during their pregnancy. They were thrilled to welcome a healthy baby girl. In a documented case, NIPT detected a high risk of Down syndrome. This allowed the family to prepare emotionally, medically, and logistically before their child's birth. However, no test is perfect. There are rare cases where NIPT results may give false positives or negatives. For example, one family received a low-risk result, but the baby was later diagnosed with a chromosomal condition, highlighting the importance of follow-up testing. Famous stories related to NIPT. In recent years, several high-profile stories have brought NIPT into the spotlight, each illustrating different aspects of this groundbreaking technology. Serena and Greg's surprise gender reveal. Serena and Greg, a couple eagerly awaiting their first child, decided to use NIPT primarily to check for chromosomal abnormalities. When they learned the test could also reveal the baby's gender with high accuracy, they were thrilled. The revelation that they were expecting a baby girl came earlier than the conventional 20-week ultrasound and was celebrated with a gender reveal party that included close family and friends. The false positive dilemma. In 2017, a story emerged about a couple in the US who experienced emotional turmoil after their NIPT results indicated a high risk for trisomy 18, Edwards syndrome. They spent weeks consulting specialists and considering options, only to find out through an invasive amniocentesis that the baby was perfectly healthy. This case highlighted the importance of confirmatory testing and the emotional complexity surrounding NIPT results. Ethical concerns in Iceland. A controversial report from Iceland revealed that nearly all pregnancies identified as high risk for Down syndrome through prenatal screening, including NIPT, were terminated. This sparked international debate about the ethical implications of such tests, disability rights, and societal values around inclusivity. Benefits of NIPT. Why has NIPT become such a game-changer in obstetrics? Here are its key advantages. Early screening. NIPT provides insights as early as the first trimester, giving parents more time to prepare. High accuracy. For common trisomies, detection rates exceed 99% and no risk to baby. As a non-invasive procedure, it's completely safe for the fetus. Emotional relief. Many parents report reduced anxiety and better peace of mind during pregnancy. Limitations of NIPT. While NIPT is a powerful tool, it's important to understand its limitations. Not a diagnostic test. NIPT is a screening tool, not a definitive diagnostic test. High-risk results must be confirmed with procedures like amniocentesis or CVS, limited scope. It doesn't detect all genetic conditions or abnormalities. Multiple pregnancies NIPT may be less accurate for twins or higher-order multiples. Always consult your healthcare provider to discuss NIPT results and next steps. Ethical considerations. NIPT has sparked important ethical discussions. While it empowers parents with early information, some worry about increased pressure to terminate pregnancies when abnormalities are detected. Balancing reproductive autonomy with societal pressures is an ongoing conversation. Key takeaways. NIPT is a revolutionary advance in prenatal care, offering safe, early, and highly accurate screening for genetic conditions. While it has its limitations, its benefits make it a cornerstone of modern obstetrics. If you're considering NIPT, consult with your healthcare provider to understand its potential impact on your pregnancy journey. Outro. Thank you for joining us on Medicine Health 360. If you found this video helpful, please give it a thumbs up, share it with others, and hit the subscribe button for more insights into the world of medicine and health. Have questions or personal experiences with NIPT? Drop them in the comments below. We'd love to hear from you. Stay informed, stay healthy, and see you in the next video. Now let's delve into the scientific and medical principles that underpin non-invasive prenatal testing, or NIPT. First, let's talk about the genetic basis. NIPT primarily looks at cell-free fetal DNA, often abbreviated as cfF-DNA. This cfF-DNA originates from placental trophoblast cells and constitutes about 5 to 15% of the total cell-free DNA in maternal blood during pregnancy. Remarkably, cfF-DNA mirrors the fetal genome and can be detected as early as 5 weeks gestation, with levels peaking in the second trimester. Moving on to trisomies and chromosomal abnormalities. NIPT evaluates the risks for common aneuploidies such as trisomy 21, also known as Down syndrome, trisomy 18, or Edwards syndrome and trisomy 13, known as Fetal syndrome. Some advanced tests also screen for sex chromosome aneuploidies, including conditions like Turner syndrome. Lastly, let's touch upon microdeletion syndromes. Advanced NIPT platforms are capable of detecting conditions caused by small missing chromosome segments like DiGeorge syndrome. Understanding these scientific principles provides a deeper appreciation of how NIPT can offer crucial insights into fetal health, making it a valuable tool in modern prenatal care. Thank you for watching. Now let's explore the physiological principles. The placenta facilitates the exchange of nutrients, oxygen, and waste, inadvertently releasing cfF-DNA into maternal circulation. Its detection depends on advanced assays to differentiate fetal from maternal DNA. Additionally, cfF-DNA is smaller and more fragmented compared to maternal DNA, a feature exploited for selective sequencing. Now let's discuss the biochemical and molecular techniques. Next-generation sequencing, or NGS, is the cornerstone of NIPT. NGS identifies and quantifies DNA fragments to detect chromosomal imbalances. Other methods like microarray analysis and digital droplet PCR are also employed. Statistical algorithms evaluate sequencing data, calculating the probability of chromosomal abnormalities with high sensitivity, 99% for trisomy 21, and specificity. The non-invasive advantage of NIPT is that, unlike invasive tests such as amniocentesis, it carries no procedural risk of miscarriage, making it a preferred initial screening method. Now let's discuss obstetric and clinical applications. NIPT is offered as early as 9-10 weeks gestation, providing critical insights at an early stage. A low-risk result typically negates the need for further testing, while high-risk results warrant confirmatory procedures like chorionic villus sampling, CVS, or amniocentesis. While NIPT is applicable in twin pregnancies, its accuracy may be reduced. Screening for certain chromosomal conditions is limited in such cases. Emerging applications. As technology advances, so do the applications of non-invasive prenatal testing, or NIPT. First, let's discuss maternal health insights. Unusual DNA patterns in maternal blood can indicate undiagnosed conditions, including cancers or placental dysfunction. This means that NIPT can potentially offer critical health insights for the mother, beyond just the fetus. Next, let's talk about expanded panels. Advanced NIPTs are expanding to detect monogenic disorders, providing insights into conditions like cystic fibrosis and sickle cell anemia. This opens up new possibilities for early intervention and management. These emerging applications highlight the evolving capabilities of NIPT, making it an even more valuable tool in prenatal care. Thank you for watching. Now let's delve into the limitations and future directions of non-invasive prenatal testing (NIPT). First, let's talk about coverage and accuracy. While NIPT is excellent for detecting common aneuploidies such as Down syndrome, it may miss rarer chromosomal abnormalities or structural rearrangements. This limitation means that while NIPT is a powerful tool, it is not infallible and should be used in conjunction with other diagnostic methods when necessary. Next, we'll look at artificial intelligence integration. Machine learning algorithms are being developed to improve the interpretation of NIPT data. These advanced algorithms aim to increase sensitivity for detecting complex genomic anomalies, potentially making NIPT more accurate and comprehensive in the future. These advancements reflect the ongoing efforts to enhance the reliability and scope of NIPT, making it an even more indispensable tool in prenatal care. Thank you for watching.